Hi David, welcome to our presentation on high-intensity interval training versus moderate-intensity aerobic exercise as an effective method for weight loss and skin fold reduction in overweight males. This presentation is by Amy, Chris, Georgia, Hilla, Matthew and Shaylee. In Australia, 1 in 4 adults are obese. This gives Australia one of the highest rates of obesity in the world. It's widely accepted that obesity increases the risk of many burdening diseases, including coronary heart disease, stroke, and type 2 diabetes. It is also widely accepted that exercise can be an effective approach to losing weight and maintaining a healthy weight. In Australia, nearly 40% of males and 60% of females perform insufficient daily exercise. Exercise programs commonly prescribed for weight loss usually involve continuous, moderate-intensity aerobic exercise. These follow the Australian Heart Foundation clinical guidelines. These programs can, however, be time-consuming and at times may fail to deliver the desired weight loss results. The most common reason for failing to adhere to an exercise program is that the participants don't have enough time to complete their exercise. High-intensity interval training comprises of repeated bouts of high-intensity exercise for 30 seconds to a few minutes, separated by recovery periods that may involve low-intensity exercise or no exercise at all. The Wingate protocol is the most used exercise method for studies involving HIIT. This involves 4 to 6 bouts of cycling at a maximal effort, and that equals an intensity of greater than 90% of VO2, followed by resting for 4 minutes before cycling again. This is usually repeated 3 times per week in study conditions, and per week this amounts to 2 to 3 minutes of maximal exercise per session and a total exercise time of around 25 minutes. This makes it a very time-efficient way to perform exercise. The Wingate protocol has been found to be extremely taxing and requires participants with a very high level of motivation in order to endure the discomfort. For then, it is unlikely to be suitable for most overweight, sedentary individuals who are not used to performing vigorous exercise. For these cases, other less challenging HIIT programs may be used. In a study by Trapp and others, an 8-second sprint on a cycle followed by 12 seconds of low-intensity cycling for a total of 20 minutes was performed for overweight female participants.
Orange Theory Fitness is a workout that involves a 1-hour session where people are pushed to exercise in a zone that is 84% or above their heart rate maximum for at least 12 to 20 minutes of the class. The benefit of this is to be reaching EPOC and therefore increasing the fat burn post-workout. The concept has mainly anaerobic elements to the workout, with high intensity being a main focus. 3 main types of equipment are used: a rowing machine, a treadmill, and a series of weights. Each of these forms of exercise incorporates bouts of high intensity followed by short recoveries. EPOC, excess post-exercise oxygen consumption, refers to the elevation of metabolism as a result of post-exercise oxygen consumption. It has been determined that with an increase in workout intensity, the duration of EPOC is prolonged, which is beneficial for losing weight if coincided with an adequate diet. However, to have the ability to exercise at an intensity that is high enough to generate the full benefit of EPOC, the person must be athletic enough to reach a high percentage of intensity. During this presentation of determining the factors associated with weight loss and either anaerobic or aerobic training, it is necessary to consider the fitness level of the subject.
Aerobic exercise involves exercising at a submaximal intensity for an extended period of time. It is recommended that people exercise for around 150 minutes per week or 200 to 300 minutes per week for obese individuals. This equates to 5 or so sessions at 30 minutes each session, intensity of around 50 to 65% of VO2 max. A study by Keating in 2014 in the Journal of Obesity compared the benefits of doing high-intensity interval training versus aerobic exercise. They found that while high-intensity interval training was a time-efficient way to gain cardio fitness and work capacity, the results in fat loss were minimal. They also found that aerobic exercise was more effective in reducing total body fat in previously inactive overweight individuals. They concluded that HIIT was a time-effective way to gain improvements in fitness, but shouldn't be used as a shortcut for weight loss.
Although exercise is a commonly known factor in losing weight, if diet is not considered in this process, then the results can be minimal. A combination of a low-fat diet alongside a substantial exercise regime leads to the most beneficial results for weight loss. A healthy diet is also important in conjunction with exercise for overweight people, not only to lose weight, but also to improve their at-risk health factors, which are associated with being overweight. When determining the most appropriate diet for an overweight person to follow in their pursuit of weight loss, studies have not been able to indicate diet which produces more successful results than alternate comparison. However, when losing weight, a pilot study in 2012 determined that those who lost weight gradually had an increased chance of keeping the weight off than those who had a rapid weight loss. The group who lost weight gradually were also able to lower their blood pressure and cholesterol levels. An appropriate intake of macronutrients, which consists of carbohydrates, fats, and proteins, is as followed, recommended by the Food and Nutrition Board Institute of Medicine. Carbohydrates should make up 45 to 65% of a person's total daily energy intake. For fat, it should be 20 to 35% of a person's total daily intake, and for protein, 0.8 grams of protein per kilogram of body weight. When considering the correct carbs to eat, whole wheat products are preferable as they contain high levels of fiber and provide longer lasting feels of fullness.
There are many benefits to high-intensity interval training as well as aerobic training. Regular high-intensity training demonstrates a number of benefits for high-risk populations. These include considerable improvement in aerobic and anaerobic fitness levels. The mechanisms underlying increased aerobic fitness responses are unclear, however, a key contributor is the degradation of phosphocreatine through repeated bouts of high-intensity training. In addition, high-intensity training results in various skeletal muscle adaptations, consequently enhancing skeletal muscle fat oxidation and glucose tolerance. Furthermore, high-intensity training decreases fasting insulin and insulin resistance. These changes in insulin severity are largely due to the skeletal muscle adaptations, including increased capacity for oxidizing fatty acids and glycolytic enzyme content. In contrast, aerobic training benefits include improved serum lipid profiles, improved blood pressure, and reduced risk of stroke, acute coronary syndrome. Aerobic and high-intensity interval training present a variety of acute responses. High-intensity interval training includes greater increase in blood pressure, lower increase in heart rate, decrease in substrate metabolism, greater increase in blood pressure lactate levels, and delayed onset of muscle soreness. Aerobic training includes lower increase in blood pressure, greater increase in heart rate, increase in fat utilization, lower increase in blood lactate levels, and an increase in respiratory rate. Not only are there acute responses to training, but there are long-term adaptations to both training programs. For high-intensity interval training, muscle hypertrophy, increased strength and increased power, an increase in bone density, an increase in neurological recruitment. For aerobic training, an increase in left ventricular size, increase in stroke volume, decrease in resting, an increase in mitochondrial number and size, an increase in oxygen extraction.
As aerobic exercise is of moderate intensity and is long duration, the energy system predominantly used is the oxidative phosphorylation system, which is a combination of two metabolic processes, the Krebs cycle and the electron transport chain. However, in the transition from rest to moderate exercise, anaerobic energy sources are used. As soon as a steady state is obtained, however, the ATP requirements are met by aerobic metabolism. In high-intensity interval training, a variety of energy systems are used. The energy to perform short-term, high-intensity exercise, such as sprinting or all-out cycling, comes primarily from anaerobic systems. In the case of high-intensity interval training, the high-intensity portion of exercise would come from a combination of the ATP-CP system and anaerobic glycolysis, with glycolysis dominating since the ATP-CP system is used during the first few seconds of high-intensity exercise, roughly the first 5 to 10 seconds. The transition from the ATP-CP system to the glycolysis system is gradual, and during the cooldown periods of the high-intensity interval training, the energy utilized from the oxidative phosphorylation system.
2 overweight males aged 18 years and over were selected to partake in this exercise intervention following the completion of a self-administered and self-evaluated adult pre-exercise screening tool. Each participant's medical history was examined using the medical history questionnaire. Following the procedures for assessment and screening, participants were randomly assigned to complete the 6-week exercise regime of high-intensity or low-intensity exercise. Stage 1 of the screening process identified individuals with a known disease or presented the signs and symptoms of a disease. For example, has your doctor ever told you that you have a heart condition, or have you ever suffered a stroke? Participants must answer no to each of the 7 questions to proceed to undertake physical activity. Stage 2 recognised individuals with other conditions or risk factors to assist with appropriate exercise prescription. For example, age, family history, BMI, body circumferences, and current physical activity level. Each answer was equivalent to a risk factor of 0 or +1. Subjects who received a risk factor less than 2 were classified as a low-risk client who may participate in physical activity at a vigorous or high intensity. A risk factor greater than or equal to 2 represents a moderate risk client who may participate in physical activity at a light or moderate intensity. Both participants recorded a total risk factor of greater than 2, therefore identified as moderate risk clients.
There are many special considerations for obese and overweight populations. The first is the modification of equipment. This may include adjustments in size of cycle or rowing seats to make the exercise experience more comfortable and to encourage continued participation. It is also important to assess the weight limits of machines such as treadmills to ensure that it meets the weight specifications of the participants for safety purposes. Furthermore, modifications in screening equipment such as the cuff size of blood pressure machines may be required to minimize potential for inaccurate measurements. It is also important to recognize the potential exercise capacity among obese and overweight population. To overcome this, previous studies have suggested the inclusion of this and the use of regular group meetings with exercise coaches to set activity goals, which may be beneficial to clients. A low initial workload may also increase exercise adherence. Another important consideration when working with obese and overweight populations is to identify their behavioral responses and barriers to exercise. Obese and overweight people may feel intimidated when attending the gym, which may affect exercise adherence. In order to overcome these obstacles, obese clients may perform gym exercises in a separate studio to avoid competitive areas where other gym users may be present. Positioning equipment away from mirrors and attending the gym at non-peak hours may make the exercise experience more comfortable for obese populations. In this case study, the relative contraindications of the recruited participants were considered before beginning the exercise program. These include the evaluation of any existing comorbidities, including diabetes and hypertension, or other health issues such as musculoskeletal conditions or orthopedic injury and surgery. Medical parameters such as heart rate, blood pressure, or blood glucose may need to be monitored for patients with existing comorbidities. Excessive body weight predisposes individuals to acute and overuse injuries. Therefore, weight loss may reduce the risk of developing knee osteoarthritis among obese and overweight individuals. As such, proper warm-up, stretching, and cool-down should also be performed as part of an exercise program. Participants in this study were qualified to continue with the exercise program as their health status have met the requirements of exercise safety. There are a variety of safety precautions to be aware of for obese and overweight populations. The initial exercise prescription may be set at or below the intensity generally recommended for the general population to ensure that the client is capable of performing exercises at the specific intensity. It is also important to ensure that the obese client has the correct exercise gear, such as supportive shock-absorbing footwear. Environmental conditions such as high or low temperature and high humidity may influence on exercise performance by posing physiological challenges. Obese and overweight patients should take extra precautions on heat exhaustion and risk of hypothermia, given the possible impairments in heat dissipation. In general, loose-fitting, absorbent mesh clothing are recommended to allow better heat exchange and effective cooling during exercise. Proper hydration is also important for the obese population as they are susceptible to dehydration.
Exercise intensity can be prescribed and tested based upon maximal oxygen uptake, maximum heart rate, and rate of perceived exertion. Exercise intensity prescription is frequently based on the percentage of maximal oxygen uptake, peak oxygen uptake, or oxygen uptake reserve. Oxygen uptake reserve is the difference between VO2 max and resting VO2 and is used to assess exercise intensity. Exercise intensity can also be prescribed based upon the percentage of maximum heart rate. Estimated HR max equals 220 minus the subject's age. Due to a lower cardiorespiratory fitness level in overweight and obese populations, parameters based on percentage of maximal oxygen uptake or percentage of maximum heart rate must be used with caution when prescribing exercise. Rate of perceived exertion relates to how hard an individual feels their body is working and the level of fatigue experienced. The most common tool used to measure rate of perceived exertion is the Borg rating of perceived exertion scale.
According to the ACSM guideline, exercise prescription is divided into 3 steps. The first step is assessing health and fitness information. The second step is to interpret the information, and the third step is to formulate an exercise prescription based on the interpreted information and the goals of the client. Exercise prescription is a means of using the principles of specificity, overload, individualization, and frequency, along with assessment to provide an effective exercise training regimen. In our case, the exercise training regimen we have developed is specifically tailored for weight loss in an overweight and obese population. High-intensity interval training, also known as HIIT, is a relatively new training method for weight loss. Because of this, an abundance of studies have recently been conducted on its effectiveness. Studies recommend that HIIT should be used at least 3 to 4 times a week at an intensity of 80 to 95% of the maximum heart rate for durations of around 30 to 40 minutes each session for maximal results. Aerobic training has been the traditional method for weight loss. It involves continuous, moderate intensity aerobic exercise as per the Australian Heart Foundation clinical guidelines. The recommended weekly volume of aerobic training for fitness improvement and weight loss is of 150 minutes, which serves as a minimum for the treatment of obesity. Recent studies have revised this, however, and state that 200 to 300 minutes of aerobic training per week should be performed for long-term weight loss. The consensus concerning intensity is that moderate intensity aerobic exercise at 55 to 69% of the maximum heart rate is appropriate for the management of body weight.
Pre-exercise warm-up is variable to the activity and intensity to be performed. Static stretching can be performed, however it is recommended that the stretching is only held for a short period of time. Post-exercise, when the muscles have been working, is the optimal time for stretching to reach one's full flexibility potential. Following a workout or during a class such as Pilates or yoga. In order to avoid injury by having an adequate pre-exercise warm-up, a gradual increase in intensity is required. Flexibility can be an easy fitness component to improve. A 2013 study compared a male control group continuing their daily exercise with a group of males who continued their daily exercise whilst undergoing a 12-week stretching program. By the end of the 12 weeks, the group who had completed the stretching program had a significantly higher increase in flexibility. Cooling down is relevant post-exercise to maintain blood flow and prevent blood from pooling. A cool down should be performed by decreasing the activity intensity to a slower and easier level. This will keep the blood circulating to the working muscles to aid in recovery.
The type, mode, and frequency of the exercise programs we developed were made in regards to the recommendations of the ACSM guidelines and various recent studies on weight loss. The HIIT training program we prescribed consists of high-intensity sprint training as well as high-intensity recumbent cycling at an intensity of 80 to 95% of the heart rate max, utilizing the Wingate protocol. Recumbent cycling was utilized instead of upright cycling because various studies have documented that recumbent cycling is more beneficial than upright cycling due to posture and comfort. The aerobic program consists of moderate intensity jogging and moderate intensity recumbent cycling at 55 to 69% of the maximum heart rate. In both programs, the principles of frequency and duration of exercise was increased over the 6 weeks to induce progression and overload. As you can see from the HIIT exercise program, Progression and overload was incorporated, with one session of HIIT consisting of 20 minutes in the first week, progressing to 4 sessions consisting of 40 minutes by week 6. Similarly to the HIIT training program, the principles of progression and overload were incorporated in regards to volume and duration over the 6 weeks for the aerobic training program. The program progressed from 2 40-minute training sessions in week 1 to 6 training sessions of 60-minute duration in week 6.
Results indicate no significant differences occurred in body composition characteristics between the aerobic and HIIT individuals. Post-aerobic intervention results indicate body mass incurred a loss of 9.2 kilos. This influenced the BMI, decreasing it from 36.6 to 34. Although still considered obese, the individual was closer to attaining a healthier BMI than he was prior to training. After reassessment of skin folds, this individual also had an average decrease of 2.2 millimeters from his body, indicating there was a decrease in body fat percentage. Post-HIIT intervention results indicate body mass incurred a loss of 12.3 kilos. This reduced the individual's BMI from 38.4 to 34.2. Reassessment of skin folds indicate an overall decrease of 1.8 millimeters from the body, which in turn means there is an overall reduction of fat throughout the body.
A systematic review on exercise for overweight or obesity found on Cochrane database displayed similar results to our case study. The results of the systematic review support the hypothesis that vigorous activity is more effective than moderate or light intensity exercise for inducing weight loss. In this study, high and low intensity exercise were associated with weight loss, both when combined with dietary weight loss methods and when undertaken without dietary change. The study did find, however, that high intensity exercise was only significantly better than low intensity exercise at inducing weight loss when undertaken without dietary change. When diet was also modified, exercise intensity did not significantly affect the degree of weight loss. This table from the systematic review compared high intensity training and low intensity training without dietary change on the effect of weight loss in kilograms. As displayed in the table, you can see that there was a greater mean difference of weight loss from high-intensity exercise than low-intensity exercise. This means that the intensity of exercise performed has a significant effect on weight loss without dietary change. This second table, taken from the systematic review, compared high versus low-intensity exercise with dietary change on weight change in kilograms. As you can see, both high-intensity and low-intensity training resulted in very similar mean weight loss values. What this means is that training intensity does not particularly affect weight loss in conjunction to dietary change. It has been suggested that the effects of dietary change outweigh or counteract the effects of exercise intensity.
Implications for physiotherapy practice require therapists to consider risks and contraindications associated with the overweight and obese population. Therapists are required to acknowledge common adherences to exercise and need to tailor exercise programs specific to needs and goals.
In conclusion, through the results of our case study and through research of various studies, we have found that there are weight loss benefits from both HIIT and aerobic training programs. However, due to the safety precautions and contraindications that high-intensity exercise may present for obese and overweight populations, aerobic training may be more suitable. What we as a group suggest is that a combination of both training methods in conjunction with a healthy diet will be optimal for weight loss among obese and overweight populations.